Part 4, Chapter 12, Part 4, Periodization and the OPT Model Implementing the Planned Sports Performance Training, page 435, Part 4. Periodization has been highly evaluated in the scientific literature with continued recent research examining variations in training and the bearing of such variation on physiological development. Periodization is an essential part of planning and programming of sports training, characterized by a division of training into cycles or segments, enabling the sports performance professional to target specific adaptations during each cycle. Periodization structures the training process to target specific abilities, enabling athletes to focus on what they must do to improve overall performance. Benefits of periodization include promoting the optimization of the time devoted to training, developing the multivariate components of sport skills, preventing fatigue and burnout, and matching training phases to competition demands. Periodization ensures a training roadmap is in place and specific adaptation can be targeted at the right time to maximize the benefit for the athlete. Research continues to demonstrate the greater effectiveness of periodized training compared to non-periodized for improvements in strength. Non-periodized training is less structured and does not always have a focus for the specific training demands. Better, a progressive and a well-developed plan designed to maximize athlete benefit and adaptation while addressing their needs for injury prevention and athletic development will allow them to effectively progress. It is the application of scientific evidence to this program that truly allows the athlete to make maximum gains in their training. The training plan. To accomplish goals, an athlete's training program should involve both short and long-term planning. A training plan is a specific plan designed to meet the athlete's training and performance goals. This plan will determine the forms of training to be used, how long the plan will take, how often the plan will change, and what specific exercises will be performed. The long-term aspect of the training plan is known as a macrocycle, while the short-term aspects are termed mesocycle and microcycle. When the plan is viewed from the meso to the microcycle, the athlete will be able to see the future advancement toward individual goals in a timely, organized fashion. A macrocycle organizes the training program over 1 year. That provides the athlete with a blueprint or map of how the OPT training program will progress month by month to meet the desired goal. This gives the athlete a clear representation of how the plan works and how long it will take to get there. In figure 12.2, the column on the far left represents the period or main training adaptation. The second column shows the specific phases of the OPT model that make up each specific adaptation of training. Macrocycle is further broken down into periods of training called mesocycles. Each mesocycle lasts for approximately 1 to 3 months and generally follows the different seasons: off-season, pre-season, in-season. An athlete will move through during their macrocycle. The mesocycle details the specific days of each workout, showing the athlete exactly what phase of the OPT model, the type of training will be required each day of the week. Once each level of training has been accomplished, a more undulating type of plan can be followed, where one day may be more of a stabilization workout, the next day may be more of a strength workout, and the day after That may be more of a power workout. The plan will also outline when the reassessment will occur. The mesocycle will also inform the athlete of the necessary cardio, flexibility, and corrective exercise requirements. Each mesocycle will also illustrate an athlete's microcycle, the specific workouts the athlete will do for that week. The microcycle gives a picture of exactly what phases will be included in each workout over the period of time. Periodization has been shown to be an effective form of program design and provides the repeated use of different forms of training at specific times in an annual training program to elicit specific adaptations, such as stabilization, strength, and power. By intentionally cycling through different periods or phases of training, the acute variables are manipulated to adjust the volume and intensity of training. By controlling the volume of training over time in a given program, periodization allows for maximum levels of adaptation while minimizing the risk of overreaching and overtraining. This is a primary benefit of periodization because overtraining may lead to fatigue and eventually injury. Macrocycle, 1 year. Mesocycle, 1 to 3 months, and shows which phases will be required each day of each week. Microcycle, training plan, specific workouts that spans 1 week to show which exercise are required. Show that. Different periods or phases of training seen in a traditional periodization model include a preparatory period, the off-season, first transition period, competitive period, in-season, and second transition, active rest. In OPT model, these are simplified into stabilization, strength, endurance, hypertrophy, and maximal strength, and power. The OPT model, seen in a phase-specific model of training, includes 6 different phases of training. These phases systematically progress all athletes through the 3 main adaptations of stabilization, strength, and power. Before discussing the different levels of OPT model, it will be important to briefly discuss corrective exercise training. At the end of a season, an athlete may be required to spend some time performing this form of training prior to starting the phases of the OPT model. Corrective exercise training is designed to correct muscle imbalances, joint dysfunctions, neuromuscular deficits, and postural distortion patterns potentially developed during the season. It is also designed to recondition and improve total kinetic chain structural integrity. Corrective exercise will help prepare the athlete for the higher intensity training that will come in the phases of OPT model. The first level of training in the OPT model focuses on main adaptation, stabilization, or anatomical adaptation, and is designed to prepare the body for demands of higher levels of training to follow. This period is as crucial for the beginner as it is for the experienced athlete coming back from a detrained state. It is also necessary to cycle back through after periods of strength and power training in order to maintain a high degree of core and joint stability. In addition, it allows the body to rest from more intense bouts of training. Stabilization training improves muscle imbalances, improves stabilization of the core musculature, prevents tissue overload by preparing muscles, tendons, ligaments, and joints for for the upcoming imposed demands of training, improves overall cardiorespiratory and neuromuscular condition, establishes proper movement patterns or exercise technique. The above goals are accomplished through low-intensity, high-repetition training programs that emphasize core and joint stabilization, as opposed to increasing the strength of the arms and legs. This phase incorporates exercise that progressively challenge the body's stability requirements or proprioception, as opposed to how much weight is being used. Therefore, the primary means of advancing throughout this phase is to increase the intensity of training by ramping up the proprioceptive demands of the exercise. This form of training has been shown to be extremely effective for increasing neuromuscular efficiency. The stabilization period of training in the OPT model consists of a single phase of training, stabilization endurance. Phase 1. Stabilization endurance training is designed to create optimum levels of stabilization, strength, and postural control, and should also be used between periods of higher intensity training seen in phase 2 through 6. This will allow for proper recovery and maintenance of high levels of stability that will ensure optimal adaptations for strength, power, or both. The primary focus when progressing in this phase is on increasing the proprioception, control, and stability of the exercise, rather than just the load. This phase of training focuses on increased stability, muscular endurance, increasing neuromuscular efficiency of the core musculature, improving inter- and intramuscular coordination. Acute variables can be progressed if the athlete is starting in the stabilization endurance phase, with minimal to no training background, and is also fairly conditioned with no major muscle imbalances. The sports performance professional will design the program to increase repetitions and challenge proprioception in order to establish the necessary core muscle endurance. The intensity of the weight will remain low to allow the athlete to focus on proprioceptive control and neuromuscular efficiency. The well-designed program will have an athlete in the phase of training for about 4 weeks in preparation for the demands of strength and endurance. Acute variables also be progressed if the athlete is fairly conditioned and has a good level of training background. The program design should progress the athlete by slowly increasing intensity and increasing the repetition to establish the necessary levels of endurance. Strength stage. The second level of training in the OPT model focuses on main adaptations of strength, which include strength endurance, hypertrophy, and maximal strength. It is designed to maintain stability while increasing the amount of stress placed upon the body to increase muscle size and strength. This period of training is necessary progression to develop muscle size, muscle strength, and improve overall general performance. The focus of this strength period of training is increase the ability of the core musculature to stabilize pelvis and spine under heavier loads through more complete ranges of motion. Increases the load-bearing capabilities of muscles, tendons, ligaments, and joints. Increase the volume of training with more reps, sets, and intensities. Increase the metabolic demand by taxing the ATP, CP, and glycolytic energy system to induce cellular changes in muscle, weight loss, hypertrophy, or both. Increase motor unit recruitment, frequency of motor unit recruitment, and motor unit synchronization, maximal strength. This model consists of 3 phases: Phase 2, strength and endurance training; Phase 3, hypertrophy; Phase 4, maximal. Strength endurance is a hybrid form of training that promotes increased stabilization, endurance, hypertrophy, and strength. This form of training entails the use of superset techniques, where a more stable exercise such as bench press is immediately followed with a stabilization exercise, similar biomechanical motions such as a stability ball push-up. Thus, for every set of an exercise body part performed according to the acute variables, there are actually 2 exercises or 2 sets being performed. High amounts of volume can be generated in this phase of training. Acute variables can be progressed once the athlete properly progressed through Phase 1. Because the goal does not require hypertrophy, sets, repetition, and intensity range will remain moderate. Acute variables can be progressed if an athlete with the goal to increase lean body mass and general performance has properly progressed through Phase 1 of the OPT model. Because the goal of this phase of training is strength and hypertrophy, tone should increase intensity and decrease the repetitions to establish the necessary levels of strength. An athlete will generally stay in this phase of training for a 4-week duration. Hypertrophy training, adaptation, maximal muscle growth, focusing on high levels of volume and minimal rest periods to force cellular changes. An athlete will generally use this phase 4 weeks before cycling back through Phase 1 and 2, or progressing on to Phase 4, 5, and 6. Hypertrophy, maximal strength. Phase focus on increasing load placed upon the tissue of the body. Maximal intensity improves. Recruitment of motor units. Rate of force production. Motor unit synchronization. Power. The third level of training is power, designed to increase rate of force production. This form of training uses both the strength and stabilization adaptations acquired in the previous phase of training, and then applies them with more realistic speeds and forces that the body will encounter in sport. Power is simply defined as force multiplied by velocity. P equals F times V. Therefore, any increase in either force and/or velocity will produce an increase in power. This is accomplished by either increasing the load or force at any velocity, as might be seen in a progressive strength training, or increasing the speed or velocity with which a load is improved. The combined effect is a better rate of force production during athletic activities. Heavy loads of 85% to 100% at low speeds. Light loads. To develop power, individuals must train both heavy loads, 85, and at low speeds, and light loads at high speeds. The focus of power training to increase rate of force production by increasing the number of motor units activated. The synchrony between them. The synchrony between them and the speed. We know all this. We know all this power stuff. All right, let me